Hi, have you feel a hole in your teeth? Hi, my name is Dr. Myrna Lazaga here in San Diego. Today we're going to talk about fillings, the common questions that you may have about fillings. You would need a tooth filling if you have a decay on your tooth, or there's a hole in your tooth, or there is sensitivity on your tooth. One way, if you could tell that you need a filling or other restoration, of course, is to see a dentist, because the dentist will be the only one that can determine what you needed. We have tools in the office that will help us determine what you need. When you have a cavity, dentist will decide what kind of filling you have in your tooth. Is first, the dentist have to assess how big is your cavity or decay, or how is it, also where is it located. But nowadays, most of the time, we only use most white filling. So before, we used to use silver filling. So those are fillings that's usually used in the back teeth, and then white filling on the front, because that's the same color. Nowadays, we both can use white fillings both back and the front. The difference between composite fillings and amalgam fillings. First, the amalgam fillings, it has mercury on it, plus combination and with silver. It is looks like metal on it. The white filling is considered white because it can mimic the same color or shade of your teeth. So there's no mercury on it, and it looks like when after we do your filling, it looks like the filling on the back teeth and the front teeth could be different in the location and the surfaces that's involved, because the tooth at the back tends to be bigger than the teeth in the front. But otherwise, the same material that we use when for the front and on the for the back teeth are the same. When we do the fillings, usually it should not hurt, because it depends on how big or size of your decay is, or how many surfaces there are involved in having a filling. If that's big enough that we think you can be sensitive, we numb you up. But if it's something that's small and shallow, then we don't need to numb you up, and that's still making sure that you're comfortable. It should not hurt. What you would expect during a procedure, if it's like I said, bigger filling or deeper, we will numb you up. And then when we do that, you pretty much numb during the procedure. It depends on how big is the filling will be, and it could last 30 minutes to an hour. And what do you expect is we will check how your bite after we put the filling in. Normally, when we do the fillings, it takes us, depends on how big the filling is, it takes us between 30 minutes to an hour. Now, during the appointment, when you have cleaning or exam, you may not be able to have the filling done the same time, but it depends. In some cases, we can do it right there and there if we have time for that. But if we don't, most of the time, we will just schedule you for your convenience. Dental fillings last between 7 to 10 years, normally, unless there is a decay that may surface either underneath your filling or on the other side. Let's say, for example, on one side you have a filling, but then on the other side you don't have a filling. You can get cavity on the other side, and so there we have to replace your filling when there's a recurring decay. And this other surface of the no same tooth, but on the other. With the white filling that we use nowadays, you can eat right away after your fillings get done. It's pretty much set, not like the silver filling before. It takes 24 hours to completely set. You just have to be very careful when you bite because you're still probably numb for another. The white filling will cost, it's kind of hard to tell, but it will depend on how big or how many surfaces are involved in filling on a certain, let's say, for example, you have only one surface that's involved, like only on the chewing surface. That is cheaper than the one that involves also chewing surface and then another side. That would be like we call it two surface. Then that would be more expensive than the just one surface. It's more expensive because it tends to be more complicated and more time spent to do it than just our one surface filling as compared to two surfaces. Especially when the surface is involved in between your teeth, we have to make sure that when we put back the filling, that the contact is still tight, because if it's not tight, you can easily get food trapped. Now that we talked about dental fillings, if you have some more questions, please call our office at 619-477-0570. Again, this is Dr. Myrna Lazaga.